Hi, my name is Alyssa Reeves. I'm in Section 4. I'm going to be doing an IV insert. I'm going to check the physician's orders for the IV insert. I have a peripheral IV 20 gauge for basic IV meds and fluids. I'm also going to check for any pertinent lab data and any allergies that the patient might have, as well as the duration of time that the IV is going to be inserted. First thing I'm going to do now is wash my hands and prepare my equipment. I'm going to draw up 3 milliliters of normal saline. Oop. I'm so eager. And then I'm going to attach my needleless syringe to the hub of my extension tubing. And I'm just going to prime it. And I'm going to leave it in here so it maintains sterility. Now I'm going to go into the patient's room. I'm going to introduce myself. Hi, my name is Alyssa. I'm going to be your nurse today. We're going to be doing an IV, a 20 gauge for your IV fluids and meds. I'm going to ask the patient if they've had any mastectomy. I'm going to ask them what their dominant hand is, and I'm going to choose the non-dominant hand. I'm also going to ask in that hand if they've ever had renal dialysis, shunts, or fistulas. And if they haven't, we're going to go ahead and stick with that arm. I'm going to also, before I even get started with anything, check the ID band of the patient for name and date of birth. Okay, good. And then now I'm going to select the vein that's nice and bouncy and resilient. Now that I've selected that vein, I'm going to go wash my hands. I'm going to wash my hands and put on my gloves. And we're going to place the tourniquet 4 to 6 inches above the patient's chosen site. Check for a radial pulse, good pulse, and clean the area. I'm going to go in a circular motion from inward to outward. Okay. And now we are going to move on to the IV. So I'm going to stabilize the vein by pulling the skin taut. I'm going to go in at a 15-degree angle with the bevel up. We're going to have a quick pinch. And then I'm going to look for a flashback. When I have a flashback, I'm going to lower it to a 10-degree angle, insert about 1/8 of an inch further, and then I'm just going to insert the hub into the rest of the hub into the vein. Now I'm going to release the tourniquet, place pressure 1 inch above the venipuncture, and I'm going to release the stylet. We're going to put that in the sharps box, and then we're going to attach the extension tubing. Make sure that it's nice and tight. And then going to release. We're going to aspirate for blood return. Good blood return. and then we're going to flush the extension, the IV, with a stop and go motion. And now, we're maintaining positive pressure. I'm going to clamp the tubing. Okay. Now we can release the syringe and put the Tachoderm onto we're going to place it onto the hub. And I'm just going to take this off. Oh, we're going to use that to put okay. Now I'm going to place my initials, my date, the gauge size onto, and the in the length and the time as onto the, and put it on the outside. And now I'm going to stabilize the IV tubing